in general. So essentially with dietary supplements, I hate to admit this, but our industry is Wild West. There is not a lot of control as far as dietary supplements. So part of what this is to help you to educate your clients, your patients, but also for you as you choose supplement companies to work with. It's basically going to give you a mental checklist to look at as far as supplements go. So when you look at, when you think about diamonds, basically there's 4 factors that they judge a diamond by, the quality of a diamond, and that's the carat, the cut, the color, and the clarity. Those are the 4 things that basically determine the value of a diamond. So in the supplement industry, we basically boiled it down to 3, what we call the 3 Qs, the quality of supplements. So those 3 Qs are quality control, which is the manufacturing process, quality ingredients, and then finally quantitative testing. That's how you determine what a good dietary supplement is. So to begin with, we'll look at the Q1, the quality control, the manufacturing process of dietary supplements. So here's where it gets really tricky. Most have had patients or clients that have come in and said, you know what, I can get this at Walmart, I can get it at Walgreens, big box store. What's the difference between these two? Well, here's the difference. So back a few years ago in 2015, New York Attorney General found that close to 80% of the supplements at 4 of the major retailers didn't meet label claim or they were mislabeled, which is a major problem in our industry. There was also a meta study done several years back and showed that out of 800 dietary supplements, that the majority of them had unapproved ingredients or had ingredients that were not declared on the label. 20% of them had more than 1 illegal ingredient, which is kind of scary when you think about it as well. So the reason why that is important is because there was one contract manufacturer that sells to retail and to the professional market. About was January of 2020 when this FDA warning letter came out. And basically, they had to recall everything that they had made clear back to January of 2013. They had major violations, and that involved more than 800 companies and a little over 1,200 SKUs that were involved in this recall. So it is definitely can be a problem. But for us in the professional supplement market, basically we're governed by the FDA 21 CFR Part 111, Code of Federal Regulations Part 111. And what that does is that looks at the processes, the procedures, and the documentation that appear on the label of any dietary supplement. Now you see the term cGMP, we'll talk about that in a minute, but that's very key in this discussion. So why would a company want to register with the FDA? Well, basically, several years back, there was the Bioterrorism Act that came into play when some of the Tylenol ended up with cyanide in it, also after the 9/11 attacks. But also, it's actually the law for supplement companies to be registered with the FDA. Not everybody is, and that is part of the problem. So one of the first things that everybody thinks is, okay, yeah, you're going to register with the FDA. What's going to happen? They're going to show up at your doorstep one day in a bunch of black SUVs, and they're going to come in and take over your building. No, that's not what happens. So basically what triggers an FDA inspection is either you've had mandatory recalls, you've had a serious adverse event, you've made claims on your formula as to treating or diagnosing some medical condition, or you're selling banned or illegal ingredients, or you've mislabeled your product, or there are consumer complaints with your formula as well. Most of what's done by the FDA anymore is done online. They actually have what's called a group of bots where they digitally inspect your website and they look at what you're claiming and what you're doing and what you're saying about your formulas. And from there, That's where they formulate their warning letters. So here's a fact that most people don't realize is that when they find that you have a violation of FDA regulations, essentially what they do is they'll send out a corrective action letter. This corrective action letter basically tells you that you have 15 days to respond to their notification, to start taking steps toward correcting it. So then if you don't take those steps within 15 days, that's when what's called the 483 or the FDA warning letter is issued. So when you see a company get an actual FDA warning letter, that basically means that they've probably blown off this first step and have not done their due diligence to make corrective action. So I mentioned the cGMP. cGMP is a very important term to make sure that we understand well. cGMP stands for current compliant, certified, or consistent. It means current good manufacturing practice. The reason why that's important is because the FDA is constantly working with their guidances and changing their rules. So you want to be current. You want to be on top of everything when you're following the FDA rules. So to be able to follow those, you have to have someone that will help you through that process. We currently use NSF. NSF basically looks at our processes and procedures, and they make sure that we're meeting GMP or the cGMP. NSF does is they come in and they look at these FDA rules. They do an audit typically twice a year. It's kind of cool. The last couple of years, we've done so well on our audits, they gave us a pass, and we've only had to have one once a year. And they actually scored what they technically are calling A+. So we don't have any findings to speak of. It's a very expensive process. It's basically you're paying to get abused by NSF, but it keeps your company in really good shape. Beyond that, a good QC department for a supplement company is going to create what's called SOPs or standard operating procedures. For every single process, every single thing that you do within the company, there is an SOP. They also look at your literature to make sure that you're not making any claims, that you're keeping that legal, making sure that your label regulations are compliant. And I'll show you some examples of changes that have happened just in the last year. They also proof the material because it's kind of embarrassing when you send out marketing materials and there's typos and things like that. And then finally, they look at make sure that we're compliant with California Proposition 65, which basically says that everything causes cancer, and so we have to make sure that we're compliant with those rules as well. So the first area that we want to look at is the actual labeling of the dietary supplements. So one of the changes that came about in this last year is the way that you list botanicals or herbal ingredients. And so with those type of ingredients, you have to identify the type of plant that you use, you identify the part of the plant that's used, how it was processed, whether it's a powder, an extract, what have you, and then you show the potency of that actual standardized ingredient. So here's an example of that with ashwagandha is the common name. Scientific name is Withania somifera, and it's made from the root of the ashwagandha. It's an extract, and it's 5% with analytes. So you will notice if you look at a lot of people's ingredients where they have herbals or botanicals, they are not up to date on this, which you can see this is a very important feature to have and to be familiar with. So another thing that came about this year with labeling was the designation for like folate, niacin, vitamin A, D, and E. So now folate, instead of being listed in micrograms or milligrams, now folate is actually listed in DFE, which stands for dietary folate equivalent. which is kind of confusing when you first look at it, but it's a benefit because now we can compare all the different types of folate, all the way from dietary folate to folic acid to 5-methyl tetrahydrofolate to even the 6S quadrifolic, and see where they fall in that range as far as DFE goes. Vitamin D, you'll also see that it changes from IU to micrograms or milligrams. Again, can be a little bit confusing, but we've found a little workaround for that. And actually what we're doing is we can find out that we can list in brackets what the actual IUs are along with the milligrams or micrograms. So it's not going to be quite as confusing on our labels. Now, as far as sourcing of ingredients, that's very important as well. So with NuMedica, we only use dietary ingredients that are allowed in the federal, the FDA Food and Drug Cosmetic Act. We only use ingredients that are insurable, which is very important. And we try to find the highest quality raw materials as well. So examples of ingredients that in the eyes of the FDA that are not legal, and I'm not saying these are bad ingredients. Some of these ingredients are some of my favorites, but we cannot use them as a company because of how they're viewed by the FDA. For example, CBD, very popular right now, but if you look on the FDA's website, it basically says that that you cannot use CBD or THC in any dietary supplement or sell it interstate as well. Kava kava, another one of my favorite ingredients, but we can't use it because there are people that abused it in the past, and so that's when FDA made their ruling. Even colloidal silver, great ingredient, but can't be used in dietary supplements. Now you're going to see it in health food stores, but that doesn't make it legal. So part of the insurance coverage that you want to think about is that not only are you going to be covered under the company's label, but also if you're doing any private label or relabeling, make sure that you're covered under private label as well. Most companies that you're going to run into that do private label do not have that kind of coverage. We can actually name you as a additional insured for private labeling, and you can get a letter from our insurance company, which is nice because if we ever didn't pay our premiums or we got dropped, you would get notification of that you weren't covered. So that's protection for you as the end user. So now when you think about getting into the actual production of dietary supplements, you have to have flowing agents to encapsulate formulas. Flowing agents basically are lubrication for the machinery, for the blenders, and for the encapsulation. Now, there's various ones that you can use. You can use mag stearate, you can use MCC, you could use bamboo silica along with leucine, or you could use rice flour. Various opinions about all of these. There was a little bad press a few years ago about magnesium stearate. Somebody started this rumor that it was made from bug wings, which is not true. There's really nothing wrong with it, but it got a kind of a black eye. There's a few people that have an issue with rice flour. So that we try to be dynamic in that we can change which flowing agents we use. I will say that one of the factors that comes into play is that mag stearate is probably the most efficient for working with the machines. And since you're paying for the uptime or the manufacturing time of those machines, obviously the faster you get your formulas done, that's going to affect the cost of the end product. So another question comes up, okay, are we going to use veggie caps? We're going to use tablets. What's our delivery system going to look like? Of course, we've all probably heard the stories about that a lot of tablets have binders, they have lubricants, they've got coatings, plasticizers, other things. You hear those stories about how the guy works in the sewer plant, he finds a big pile of vitamins in the sewer plant. Well, that can happen with some of the cheaper ones. We typically try to use veggie caps, but in some cases, actually tablets make sense because we have formulas like our niacin or like our alpha-CU with alpha lipoic acid. they're actually made to disintegrate within like 4 or 5 hours. So you get a controlled release of those formulas. Occasionally you'll have ones that are lozenges that will dissolve like RB12. So that makes sense for them. But in general, we don't use tablets very often. So now we get into another area about the labels, and that's actually whether we're going to look at manufacture date or expiration date. And this is very important because a few years ago, the FDA started allowing manufacturers to use manufacture date. A lot easier for the FDA because basically all they have to do is look at the paperwork from the day that you made that formula and compare it with the label. And if those two match, then you get a pass. Expiration date, what you have to prove is that you're actually have a formula that's going to meet label claim at the end of, say, 2 years, or that whatever that expiration date is. Now, here's where that gets a little bit interesting. Let's say a company is using manufacture date, and that manufacture date is today. So let's say it sits on the shelf at the manufacturer for 6 months. So that some ingredients are going to start to lose a certain amount of strength. Now, if it sits on your shelf for, say, another 3 or 4 months, now you're losing strength. The clock is ticking. So if you have expiration date, obviously it's going to be all the way through that life. Now, one thing to know is that as NuMedica releases new formulas, we actually do have to put manufacture date on a new formula until we have enough history at, say, 6 months, a year, 18 months, and even 2 years to be able to claim that expiration date. But you'll see that happen quite a bit. So when you think about ingredients, if you're going to do expiration date, the first thing you have to do is accelerated aging. That's a real common test done at the manufacturer. Not the most accurate science, but it simulates 2 years. We have done something that I don't know if any other company has done this, but we actually do real-time testing. So we do a test on the raw materials when they get to the manufacturer site to check them for contamination, things like that. Then the manufacturer does a third-party assay. When it arrives at our facility, we do another third-party assay. And then finally, 2 years later, after expiration, we actually send it in to get it assayed again to make sure that it's still meeting label claim. Now, what we learned early in the game is that some ingredients lost quite a bit of potency. For example, some lose 10, 20, 30%. Some ingredients are up to 70% over 2 years. So you can see why that's important when you think about the manufacturing date story. So when you look at third-party testing, you can see that this is very important because if you ask someone for a third-party assay on their formula, you should be able to get one within 48 hours. Now, if they can't get you that within 48 hours, one of two things is either happening. They either don't have it and they're sending it off to get it tested, which usually takes about a week or two to get that done, or they're using an assay from an old lot and telling you that that's what their formula has. Now, what we've seen some people do in the past is an early formula, they'll spike the ingredients a little bit to make the assay look good. And so that's what they basically use in their files. And you're probably not going to see the overages built into those formulas. So here's some examples of some of the testing that we do. There's the GMO testing, the gluten testing. Here's also looking, it's lot specific. So it's actually done on the lot that you have. You can call our office or you have your rep call our office, and they typically within a few minutes can get a copy of an assay on our formulas. A lot of times it only happens 15, 20 minutes for it to happen. So when you think about dietary supplements, you look at diamonds. If you're going to get a diamond assay, you send it to the GIA, the Gemological Institute of America, and they have that criteria where they look at the color, cut, quality, and clarity of the diamond. Well, with dietary supplements, it's the same way. If you don't have a true assay, then it's just an opinion. So that's very important to keep in mind. We all know what cubic zirconias are. Cubic zirconia is not a bad rock if you know what's a cubic zirconia. But if you claim that CZ is a diamond, you're getting cheated. So you want to make sure that you're getting what you pay for and that you're not being sold a bill of goods. Now, there are some marketing terms that are used within our industry that are not legal. They're not correct to use. They're made up terms. For example, you hear some people will say that they're FDA approved. FDA never approves dietary supplements. In fact, every company that produces dietary supplements, you will see a disclaimer somewhere on the label that will say these products have not been looked at by the FDA, or the FDA has not approved these things. FDA doesn't get involved in that. The only time FDA shows up is if there's a problem. Some people will say that their formulas are pharmaceutical grade. That's trying to give the indication that this formula is a drug type of formula. When you start talking about pharmaceutical, that's a whole new set of rules. That's the 21 CFR Part 210 and Part 211, not the 111 for dietary supplements. I know one company that actually, they use the FDA logo on their website. When you click on that FDA logo, it actually takes you to the rules for Part 210, Part 211 for finished drugs. So it's a little deception, little smoke and mirrors. Also, some people will say that they're FDA inspected. When you say that you're FDA inspected, that basically means that the FDA has shown up and you've been in trouble. It would be kind of like if you saw across the street at your neighbor's house, there were SWAT teams, there were helicopters, there was dogs around the place, lights and sirens everywhere, and the next morning your neighbor comes out with a t-shirt that said that he was police inspected. Not likely the case. There was a problem, and that's why they showed up. A few companies will say that their formulas are made in a drug facility, or they're manufactured in a former pharmaceutical facility. Again, two separate sets of rules, and they're trying to make you think that these are drug quality dietary supplements. Not a true term. And then finally, you hear the terms nutraceutical or sometimes RX in the label. We actually used to do that as a company. And then we figured out that no, when you use those two terms, again, you're putting yourself in that other group, that 210, 211 type of group as a finished drug. So when you see those terms, basically they're putting you at risk, because those terms don't fall under the 21 CFR Part 111. Basically, that's viewed as selling pharmaceutical drugs. So now for a few minutes, we'll talk about quality ingredients. That's the second of the Qs. Those are also very important. So we kind of started calling this the ABCs of quality ingredients. So you have absorption, bioavailability, and finally cellular utilization. So when you think about absorption, we try to find ingredients or delivery systems or things that will make these particular ingredients work better. And so we actually coined the term EAT, Enhanced Absorption Technology. So the reason why this is important is because when you look at the small intestine, there's what's called the unstirred water layer as part of the mucosal lining. And essentially what that does is it keeps you from absorbing too much fat through the intestinal wall, which is a benefit. The problem is if you have an oil-based ingredient, it's not going to pass through that as well. So that's very important to keep that in mind. So with certain ingredients, you want to be very careful. For example, vitamin D is an oil-based or a fat-soluble ingredient. Same thing with vitamin E, vitamin A are the same way. So with vitamin D, you have to find a way to get it through that gut wall. Now, when you think about in your gut, bile can get through there. And the reason why, you'll see the little description of bile. Essentially, it has the water on the outside of that aggregate, and then you've got the essential fatty acids on the inside, so that it can actually take the cholesterol back into the body and be reused by the body. So with vitamin D, what we do is we actually have what's called micellization. So you take this large oil form D vitamin with a water head and a couple of lipid tails hanging off of it. You microemulsify it, you get it down to the smallest molecule that you can, and then you create an aggregate where the lipids are on the inside and the water's on the outside, so it slips through the gut wall much like bile does. So we did studies on our vitamin D several times on our micellized, and we found that it actually performed about 4 to 5 times better than an emulsified vitamin D, which is really important because everybody needs vitamin D right now with COVID and the pandemic. Now, liposomes are very similar in structure, but a little bit different. With liposomes, what you have is you have a fat bubble that you can put a water-soluble nutrient inside that fat bubble. And to some extent, you can actually put a fat-soluble vitamin in there, and it will actually kind of mix with the lipid. So what that does is it gets in and it releases a little bit slower, and it actually absorbs into the mitochondria, into the cell, very efficiently. What's nice is that bubble is made of a phospholipid, phosphatidylcholine, which is on the outside of your cells and your mitochondria, so you're actually enhancing that as well. So with the liposomals, we found that essentially the liposomals perform considerably better, about 2 or 3 times better than like in a powdered ascorbate, and they have a much greater effect. You also don't have bowel tolerance issues because they're hidden in that fat bubble. Other ingredients that you can use to enhance your absorption, for example, estrogen is a combination of astragalus and ginseng. There's studies on several nutrients where it enhanced them. Probably the main one that we like to use it with is with folate. With folate, you can actually increase folate by as much as 50%. Another one that you see is called BioPerine. It's a black pepper extract. It can make your vitamin C work better. It can make your curcumin work better. There's several things that it works better on. You don't use it on everything, but in some things it actually makes sense to do that. Another way that you can enhance absorption is by using the Albion minerals, the TRACS, the real amino acid chelate system. These minerals have been kind of rearranged, or they are bound to an amino acid. So essentially what they do is they absorb much better, much more efficiently. I've sat through several of their lectures and they're way over my head, but the one takeaway is the fact that they actually do absorb better. Now, when you think about that, that's important. And even choosing the form that you use in your formulas. There's 9 different types of magnesium that you could pick from when you make a formula. Now, every one of those types of magnesium has a purpose. It has a reason. You might want to use mag citrate if you're constipated, or you might want to use mag oxide if you're trying to melt ice off of your sidewalks. You might want to use mag threonate if you're trying to help the brain. Probably the most efficient of these magnesiums is the one from Albion. It's the bisglycinate, glycinate, malate, taurate types, the chelated magnesium. Those work much better. But if you need one of the others for a certain reason, then you do that intelligently, how you pick it out. The main thing is that you want to get magnesium, because we see that most people do not get enough magnesium, and it can be a problem. You have muscle weakness, muscle pain, and especially with depletions that you see from a lot of pharmaceuticals. So when you think about bioavailability, we've got it through the gut wall. Now we got to get it into the bloodstream. We've got to get it circulating through the body so the body can use it. So how do we do that? Well, there are examples, for example, quatrefolate that we get from Gnosis. It is a 6S5-methyltetrahydrofolate glucosamine salt. So it is in the L form. What this basically means at the end of the day is you're going to get about 20% better bioavailability with quatrefolate than you would with a regular 5-methyl tetrahydrofolate, and much, much better, 170% better than actual folic acid or dietary folate. So that's a great ingredient to use. It's expensive, but it's a great ingredient to use if you're wanting to get better bang for your buck on your folate. CoQ10 is another example that you want to get the right form. CoQ10 in its normal form is powdered. This powder doesn't melt or dissolve until it's about 118 degrees. And that's why the powdered form or the crystal form of CoQ10 is only about a 1 to 2% absorption. Now you can mix that powdered CoQ10 with an oil like olive oil or rice bran oil or something like that and get it up to about 5%, 6%. But a few years back, probably, I'd say now we're going on about 15 years ago, they figured out that if you use the right solvents, that you could actually dissolve this CoQ10 and make it crystal free and get it up to about 11 or 12% absorption. So that's way higher than you would find in the 1% that you had with the regular crystal form.
Tested okay. It's released.
Oh, wow. Good news. So why is that important? CoQ10 affects a pathway called the HMG-CoA pathway. Very important. That pathway affects how we use cholesterol, but it also, statins affect that same pathway. That same pathway is involved in the production of CoQ10. So, for example, we talk about people taking statins and then that affects their CoQ10 status. Well, that's the elephant in the room, but it's interesting to note that there is a partial list of all the drugs that affect CoQ10 production. Here's the rest of that list that affects CoQ10 production. The reason that's important is because CoQ10 creates ATP in the cell, in the Krebs cycle. Without ATP, our muscles don't perform, and since our heart is a muscle, we need ATP in our heart muscle for it to be able to perform as well. So when you think about it, someone taking a statin or one of these cardiac drugs, they're taking it to reduce their cholesterol, which is great, but they're also creating a scenario where they could actually have other problems from that. For example, you hear the commercials for the statins and they say, if you ever feel muscle pain or muscle weakness, call your doctor, as this may be a sign of a rare but serious side effect. What they're saying is that you could be close to dying of a myocardial infarction. So that's why that is so scary. This is the only country that does not require CoQ10 with statins, but all these other drugs come into play as well. Calcium is another mineral that's very important, but choosing the correct calcium is key in helping your bones and anything else that calcium affects. So some people will use the cheapest form, which is calcium carbonate. Essentially, that's ground up shells or ground up rocks. That's the same thing that you find in a roll of Tums. That's also the same thing that they spread on the fields when they're putting lime on the fields. Doesn't do much as far as actually helping your bone growth, and it actually neutralizes stomach acid, which that's a whole nother discussion. So here's a good example of a very bioavailable calcium. This is called algae cal. It's actually taken from a form of algae that's found off the coast of South America. It not only has calcium, but it's got 70 other trace minerals. So when you combine that with the correct cofactors of K2, vitamin D, magnesium, folate, things like that, they actually got a little over 4% bone growth in a year by combining that correctly. So very exciting formula. Finally, when you think about cellular utilization, that's where you want to get this actually working into the cell. How do we know that that's actually happening? We could be creating just expensive urine, expensive feces. So we want to make sure that we're actually getting what we're getting out of these formulas. How do you do that? Well, that's quantitative testing. So we recommend that all of our practitioners that work with NuMedica do testing, whether that's as simple as doing a HAQ, a health appraisal questionnaire, whether you're doing a UA, you're doing salivary tests, you're doing EKGs, or you do traditional blood labs. You do the CBC, the CMP, things like that. You're doing DEXAs to look at the bone. You do a BIA to see how electricity goes through the body, whether you're using labs like SpectraCell, Metabolic Code. There's so many that do that kind of testing. Some docs do AK, they do muscle testing. All of these are ways to basically look at the formula and give you a baseline of how that formula is working with your patients. But we highly recommend that you do this quantitative testing, just like we do testing on our formulas to make sure that what is on the label is on the label. So to kind of wrap things up, you're looking at quantitative testing. What you're doing is you're looking at the quality control, make sure that that was done. You're looking at the absorption of the nutrients. You're looking at the bioavailability of the nutrients. And then finally, you're making sure that those ingredients were actually got into the cell. So Q1 plus Q2 equals Q3. So in review, this is what you want to look for in your supplement company, or what your patients want to look for. You want to make sure your company has a current FDA registration. You want to make sure that they have a current good manufacturing practice third-party certification. NSF is usually the best way to go with that. Make sure that they have third-party assays that you can get on your lot number, on the current lot number that's on your shelf. And make sure that you're fully insured, including private label. And make sure that they're using expiration dates and not manufacturer dates as a rule. So you're going to get the full shelf life. And do a background check on your supplement company. You can go to the FDA website and look at warning letters and see what their track record is. So that's something that we want to keep in mind. So just to appreciate everyone getting on with us today. I know this is kind of a fire hose for just a few minutes. If anybody for attending and spending your time with us this Friday afternoon, you can use the code QUALITY2021 when you get online and order, and you'll get 15% off your order. This is good through next Wednesday. So take advantage of some of the NuMedica formulas. If you have any questions or comments, feel free to get in touch with me. There's my email address or our number here at the office. Be glad to help you in any way possible. We're looking at doing this on a regular basis, doing a little bit of education and helping out. The plan is next Friday, we're actually going to talk about nitric oxide and why it affects circulation, who needs it, what's it good for, and the best and worst sources for nitric oxide. So we'll be sending out invitations for that on next Friday. You'll see the formula there in Nova Complete. My boss just stuck his head in the door and said that it just cleared testing. It just passed. So there's going to be great applause over that. We're very excited that we're actually going to have that formula available very soon. So be very exciting. So hopefully you get to see everybody next Friday. And if you have any questions, feel free to ask me or your NuMedica rep, and we'll help you out. Thank you everyone for attending today.
Tim, it looks like there's some questions on the chat. Are we able to look at those at all?
Yeah, we can.
So Tim, I had a couple questions, and I think we got some of them answered, but I wanted to make sure, first of all, Katie asked a question about insurance, and I tried my best to type it out, but sometimes it's difficult to communicate via texting. So Katie,
sure.
Answer your question. Let's maybe unmute her. Oops. Goodness.
Let's see if she's still on.
I think she is. I see her on my end, but I can't.
Yes, I see her. Katie, are you there where you can unmute, or I can? invite you to unmute if you want. So,
Okay.
but insurance is very important. If you get a
It
second.
was insurance of the private label.
Yeah, so we do cover private label. Most companies do not have coverage for their private label. And the reason that is difficult is because private label is fraught with potential liability for mixing up formulas, blank bottles, labels, etc. In the eyes of the insurance company, it's called relabeling. In fact, the last time our insurance people visited, but after they saw our system and how clean it was, that we actually were able to keep our insurance. It's very expensive to keep it, but we do. I see, Barbara, you had a question about a HAQ. NuMedica doesn't have an actual official HAQ that we use. The reason why is because that's getting into that treating, diagnosing type of situation. I do have versions of HAQs that I could share with you that you could use on your own, and you can actually adapt those to whatever type of treatment that you do. I know the Metagenics one, that was the classic one, the old original one that was on paper and you had to take a pencil and fill in the little blanks. That was a tedious process, especially if you work in the office, to be able to do that. There are some electronic versions. Reach out to me and I can share those with you, or I can get them to Tim as well, and he can do that too. So.
Another question we had was the micellized D, because the technology is better, do you need to dose lower with the micellized D? And I didn't give a dose exactly because I think every patient is going to be different and it depends on if you're repleting versus maintenance. Can you cite the study?
Yeah, so testing is so important. With vitamin D, you need to know what you're doing with vitamin D. So you can do a vitamin D test for $20, $25 now. If you work it out with your lab, do the vitamin D test, see what your baseline is, dose your vitamin D up, retest. We have a lot of practitioners, and now, especially with COVID and immune issues going on right now, they actually are dosing it higher, especially when people are under stress. They burn through vitamin D a lot faster. So having that vitamin D on board is very important, especially this time of year when we're all stuck inside with the snow and everything else. So very important to do vitamin D testing and track where you're at. With our micellized, we've actually had a few people that hyperdosed it. For a few days, it's not a problem to hyperdose it, but we've had people that have hyperdosed it for weeks. And the highest number I've seen so far was a 196 on someone's vitamin D level, so which is kind of scary. So definitely do your testing. Make sure that you're doing that. Let's see, did you see any other questions, Tani?
That is what I have for now. Anyone else? Speak now or forever hold your peace. I'm just kidding. You can call us.
Absolutely. No, but appreciate everybody getting on. Hopefully we'll see you next week with our next little webinar. But
Jim, can I share something real quick? Can I share something real quick? Some of the people, can I share something now? The people that are on today, now they can forward the link to any of their constituents or associates if they want to kind of invite other people next week as well, right?
Right. Absolutely. Absolutely. Okay. And of course, this is going to be a practitioner level webinar. So it's, but it's going to be some great information. There's some very interesting studies that I'm going to share next week. So hopefully you can get on and learn a little bit about nitric oxide. So.
And Tim, can you get the link out like on Monday so we have more time to get folks?
I sure can.
That would be awesome. That would be awesome. Thanks.
I'll get that link out Monday, and